Hello to everyone. Today we are going to see the early sign of pregnancy. But before, you have to know that every person and every pregnancy is different. So, if you are pregnant, you are likely to experience a unique combination. It can be very early or it can show up later. The first sign, it is spotting or light bleeding. Many women are surprised to learn that spotting or light bleeding can be an early sign of pregnancy, but about 1/3 of women experience it. It is often called implantation bleeding. It occurs as the fertilized eggs attaches or implants itself into the uterine lining. This is different from bleeding that could occur from something like a miscarriage, because in case of miscarriage, you will have a heavy bleeding with much more blood. But here, for implantation bleeding, it is just a very little spotting. It's like a spotting. You will see a very small amount of blood in a middle from your ovulation signs. We can ask ourselves, when does implantation bleeding occur? Actually, implantation bleeding, it's a light bleeding that typically occurs 10 to 14 days after conception, which is just before or right around the time of your period is due. So, you may think you've got your period, but implantation bleeding is a light flow, which may start and stop over a couple days. Implantation bleeding is fairly common, and while it can take on a range of colors, it's more likely to be pink, brown, or light red. Your period, on the other hand, may start off light in flow and in color, but after a couple of days become heavier, changes to a crimson red color, and lasts up to a week or so. The second sign is low abdominal pain or cramping. While cramps and low abdominal pain can signal a coming period, they can also be a sign of egg implantation. But you can ask ourselves, what do implantation cramps feel like? Implantation cramps can occur with or without spotting or bleeding, and may feel different from period cramps. For example, you might feel mild to moderate pricking, pulling, or tingling that comes and goes over a few days. But menstrual cramps can often feel like throbbing or dull ache, and typically start a day or two before your periods. The third sign, it is higher basal body temperature. If you've been tracking your basal body temperature, you probably know that your basal body temperature goes up slightly right after ovulation. If you're pregnant, your temperature may remain elevated rather than dipping back down. Of course, you could be running hot for other reason, but if it lasts more than a week or few weeks, pregnancy may be the explanation. The next sign is change in cervical mucus. If you've already been checking your cervical mucus to figure out when you're most fertile, here is a reason to continue. In the first few weeks of pregnancy, the amount of cervical discharges may increase and become stickier and whiter. The next sign is breast tenderness and swelling or tingling. When you're pregnant, your body experiences big changes in hormones, especially it increase in estrogen and progesterone to support your growing baby. This change in hormones can contribute to many symptoms, including breast tenderness. Oftentimes, increase in breast tenderness, swelling, or tingling start to become noticeable a few days before a missed period. If you usually experience breast tenderness leading up to your period or shortly after it begins, pregnancy-related breast tenderness and swelling will likely be more intense than you're used to and stick around. You may also experience a nipple soreness. The next sign is fatigue. Fatigue in early pregnancy is common, and some women might notice it before they know they are pregnant. In fact, fatigue may set in as soon as 1 week after conception, This is thanks to those sudden changes in hormone levels, particularly the increase in progesterone. The seventh sign is frequent urination. If you're making more trips to the bathroom than usual around the time your next period is due, it may be a sign of pregnancy. Certainly, your drinking habit plays a big role in how many times you pee in a day. However, pregnancy increases the amount of blood flow in your body, which gives your kidney more fluid to filter and more waste to get rid of. So, if you're pregnant, you may notice you're peeing a lot more, a symptom that starts early on and unfortunately lasts throughout your pregnancy. The next sign is nausea and vomiting. This is sometimes called morning sickness, and this might be the most well-known of all pregnancy symptoms, taking the form of food aversions or nausea and even vomiting for some. This symptom can set in as early as 2 weeks after conception, which is around 4 weeks of pregnancy and right around the time you've missed your period if you are pregnant. But some may not experience nausea or vomiting at all. And despite its name, morning sickness can actually happen at any time of the day or night. The other sign is food aversion and appetite changes. A food aversion is a distaste and sometimes a negative physical reaction to smell or seeing certain food or drinks. Food aversion are more common in pregnancy in the first trimester and even beyond, and are caused by hormone called estrogen. A common food aversion in pregnancy can include meat, tea, coffee, eggs, milk, onion, garlic, and spicy food. Sometimes aversion can cause a metallic taste in the mouth even when you're not eating anything. Likewise, hormones can cause appetite change, appetite loss, and craving for specific foods. Appetite loss commonly occurs due to the nausea and vomiting. If this is the case, it's better to stick to drier, breaded food like crackers or baked chicken breast. Food craving are sudden desire for a specific food items or non-food items, which is also known as pica. Cravings are normal and common in pregnancy. Sometimes they may be for a combination of food or a foods that you dislike before pregnancy. The other sign is darkening aloras. When you're pregnant, your aloras, the area around the nipple, will likely grow and darken. Usually, these changes are gradual and continues throughout the pregnancy. However, some women notices these changes really early in combination with other symptoms. The other sign is bloating or constipation. In normal life, you all experience bloating or constipation from time to time, but both are quite common during pregnancy. Once again, those changes in hormone are culprit. They slow down digestion, which can cause buildup of air in the gut and lead to constipation. Early on, bloating or constipation may be mild or accompanied by other pregnancy symptoms, but if you really are pregnant, these symptoms may stick around throughout your whole pregnancy. Many women report that sensitivity to smell was one of the first signs of pregnancy. In fact, as men of 2/3 of the women become more sensitive or reactive to the smells around them during pregnancy. Oftentimes, this heightened sense of smell can stick with you throughout the first trimester or beyond and contribute to other signs such as nausea, food craving, and food aversion. The next sign is mood change. From the stressful day at work to the natural wonders of your menstrual cycle, there are a lot of things that can affect your mood. But change in mood are very common during pregnancy, and they may be specifically noticeable earlier on as your body gets sudden burst of estrogen and progesterone. If you're pregnant, any mood changes you're experiencing are likely coupled with other symptoms such as fatigue or nausea. You may feel more sensible or weepy, or perhaps your fuse is a little shorter and you're more easily annoyed. 14th sign. The next sign is headache. Headaches are a part of your life. They come with colds and allergies. They come with stress or fatigue, or when you cut down your caffeine to help to prepare your body for pregnancy. but they can also come with pregnancy. Headaches may happen thanks to the increased blood volume and hormones changes that occur in early pregnancy. You can also get headaches if you're dehydrated as a result of nausea. The other sign, dizziness. As blood flow increases during pregnancy, your pressure can also decrease and lead to dizziness. Usually dizziness is more of second trimester symptom, but some women can notice it very early on too. The other symptom is nasal congestion. A lot of people are shocked to learn that nasal congestion can be a pregnancy symptom. You may wonder if you're coming down with sometimes or your allergy are acting up. But if you're noticing a stuffy or running nose along with other pregnancy signs, you might be taking a pregnancy test in your near future. The mucous membrane in your nose are also affected by the hormones and increase blood flow throughout your body. This can cause blood vessels to swell, resulting in congestion and even sneezing. So, we can ask a very good question: when should you take a pregnancy test? It's usually recommended that you take a pregnancy test after you've missed your period. This is because pregnancy test measures the level of human chorionic gonadotropin hormones, what we call HCG, in your body, which is a hormone that starts to build up when you conceive. Some pregnancy test suppliers may claim their test can show results before you miss a period, but they are not always the most accurate. It can take around 3 to 4 weeks from the first day of your last period for there to be enough HCG in your body to show up on test. If you take test too soon, it could show up a false negative, where the test says you're not pregnant even if you really are. Thank you very much. If it's your first time to be here, you can subscribe.